Hi, Dr. Frank Johnson from Sport Medicine Ultrasound Canada. I'm going to show you how to scan the wrist joint. So specifically, we're talking about the radioscaphoid joint. So the patient position is usually supine with the hand fully pronated and the palm on the table. Now again, I'm propping it up a little bit so the camera can see a bit better. So your landmark is going to be the distal radius. You get that in view in the centered on with the ultrasound probe there. The orientation is going to be long on the forearm, and the movements are going to be distal towards the fingers. So as you can see, I come around from the forearm, just distal until the scaphoid comes into view. I'm going to rotate that a little bit so the camera can see a touch better. So what you see on the left is going to be the radius. On the right-hand side of the screen is going to be the scaphoid. So the area of interest is the area between them. It's almost in a sulcus there. So that's how we scan the wrist joint, specifically for how you do an injection. I'm going to show you how to scan and inject a wrist joint. Position of the patient is usually supine. However, some practitioners would prefer the patient to be seated across the table from them. The landmark is going to be the distal radius, and the orientation of the probe is long on the forearm. There we are. The movement of the probe is going to be distal towards the hand, and here we see the radius come to an end. A small amount of passive flexion of the wrist allows you to see the radioscaphoid joint, or the radioscaphoid interval. And for this injection, the needle comes quite steep, just lateral to the tendon that's in view in the screen, like so. And that's how you do a wrist joint injection.